Pregnancy is a time filled with joy and anticipation, but it can also bring unexpected health challenges. One of these challenges is gestational diabetes, a type of diabetes that develops during pregnancy. It affects how a woman's body uses sugar, an essential source of energy. While a diagnosis might seem worrying, understanding gestational diabetes is the first step to managing it effectively and ensuring a healthy pregnancy. Gestational diabetes is more common than you think. It affects a significant number of pregnant women, typically appearing in the second or third trimester. This condition arises due to hormonal changes during pregnancy, which can interfere with the body's ability to use insulin effectively. Insulin is a hormone that regulates blood sugar levels, and any disruption in its function can lead to high blood sugar, a hallmark of diabetes. The good news is that gestational diabetes can often be controlled through lifestyle changes and, in some cases, medication. Early detection is key to preventing complications for both mother and baby. If you are pregnant or planning to become pregnant, talk to your doctor about gestational diabetes. They can assess your risk factors and provide guidance on how to have a healthy and safe pregnancy. Remember, knowledge is power. By understanding gestational diabetes, you are taking a proactive step towards a healthier pregnancy journey for both you and your baby. To fully grasp gestational diabetes, it's important to understand the relationship between insulin and blood sugar in our bodies. Insulin, a hormone produced by the pancreas, acts like a key, unlocking cells to allow glucose from the blood to enter and provide energy. This process keeps our blood sugar levels in check. During pregnancy, hormonal changes can sometimes interfere with this process. The placenta, which nourishes the baby, produces hormones that can make the mother's body less sensitive to insulin. This insulin resistance means that glucose doesn't enter cells efficiently, leading to a buildup of sugar in the blood, a condition known as hyperglycemia. In response, the pancreas tries to produce more insulin to overcome the resistance. However, sometimes the pancreas can't keep up with the increased demand, and blood sugar levels remain high, resulting in gestational diabetes. This condition often resolves itself after delivery, but it signals a higher risk of developing type 2 diabetes later in life for both mother and child. Understanding the role of insulin and blood sugar in gestational diabetes provides a foundation for understanding how to manage the condition. By adopting a healthy lifestyle that includes a balanced diet and regular exercise, you can help your body use insulin more effectively and regulate your blood sugar levels. While gestational diabetes can affect any pregnant woman, certain factors can increase the likelihood of developing this condition. Being aware of these risk factors can help you take proactive steps to minimize your risk and seek early intervention if needed. Age plays a role, with women over 25 being more susceptible to gestational diabetes. Also, being overweight or obese before pregnancy significantly increases the risk, as it can lead to insulin resistance. Family history is another important factor. Having a close relative with type 2 diabetes increases your chances of developing gestational diabetes. Certain ethnicities, including African Americans, Hispanics, Native Americans, and Asian Americans, have higher rates of gestational diabetes. A previous pregnancy with gestational diabetes or having given birth to a baby weighing more than 9 pounds is also considered a risk factor. Other medical conditions such as polycystic ovary syndrome, PCOS, and prediabetes can also increase your risk. Remember, knowing your risk factors isn't meant to cause alarm, but to empower you to make informed decisions about your pregnancy health. If you have any of these risk factors, consult with your healthcare provider. They can provide personalized advice and monitor you closely for early signs of gestational diabetes. Part 4. Potential complications of gestational diabetes. When gestational diabetes isn't properly managed, it can lead to complications for both mother and baby, highlighting the importance of early diagnosis and treatment. For the mother, high blood sugar can increase the risk of preeclampsia, a serious condition characterized by high blood pressure and protein in the urine. Gestational diabetes also raises the mother's risk of needing a cesarean section, or C-section, due to the potential for a large baby. Furthermore, it increases the risk of developing type 2 diabetes later in life. The baby is also susceptible to complications. High blood sugar in the mother can cross the placenta and lead to the baby growing too large, a condition known as macrosomia. This can make delivery difficult and increase the baby's risk of hypoglycemia or low blood sugar after birth, as well as breathing problems and jaundice. In the long term, babies exposed to gestational diabetes in the womb have a higher risk of developing obesity and type 2 diabetes later in life. However, it's important to remember that these complications are not inevitable. With proper management of gestational diabetes, you can significantly reduce these risks and ensure a healthy pregnancy and delivery for both you and your baby. Part 5. Recognizing the symptoms. While some women with gestational diabetes experience no noticeable symptoms, others may exhibit certain signs that warrant attention. It's essential to be vigilant and report any unusual changes to your healthcare provider promptly. A common symptom is increased thirst that isn't relieved by drinking enough fluids. Frequent urination, often accompanying increased thirst, is another sign. You may also notice yourself feeling unusually hungry, even after eating. This is because the body's cells aren't using glucose efficiently for energy due to insulin resistance. Unexplained weight loss, despite a good appetite, can also be a symptom. Some women may experience blurred vision, a consequence of high blood sugar affecting the lens of the eye. Additionally, frequent yeast infections, particularly vaginal yeast infections, are more common in women with gestational diabetes. If you experience any of these symptoms during pregnancy, it's crucial to contact your doctor or midwife. They can conduct the necessary tests to determine whether gestational diabetes is the underlying cause and advise on the appropriate course of action. Part 6. Diagnosis and management of gestational diabetes. Diagnosing gestational diabetes is a straightforward process typically conducted between the 24th and 28th week of pregnancy. The primary method is the glucose tolerance test, which involves drinking a sugary solution and having your blood sugar levels monitored over a few hours. This test helps determine how your body processes sugar and whether your blood sugar levels are within a healthy range. If the test reveals you have gestational diabetes, your doctor will work with you to develop a management plan tailored to your needs. Managing gestational diabetes usually involves a multi-pronged approach. Lifestyle changes play a crucial role, focusing on adopting a healthy diet rich in fruits, vegetables, and whole grains, while limiting processed foods and sugary drinks. Regular physical activity such as brisk walking or swimming helps improve insulin sensitivity and regulate blood sugar levels. In some cases, these lifestyle changes alone may be enough to manage gestational diabetes. However, if blood sugar levels remain high, your doctor may prescribe insulin injections or oral medication to help control them effectively.